First of all, welcome to the seminar talk on care and climate change, a conceptual framework. I'm Ito Peng at the Department of Sociology and the Monk School, and this is Shawn Marshall from ECCC. I should I should spell that out, right?
It's Environment and Climate Change Canada. So.
Yeah. So we'll be talking. We'll be sharing this session together and talk. Hello, people from the online. Welcome. Before we start, I would like to say a few words on to acknowledge this land, as we always do. So we wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of Huron, Wendat, the Seneca, and the Mississauga of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Now, I know, although land acknowledgement statements like this might seem kind of artificial and performative, but I think it's really important to recognize and remind ourselves of the fact that we are all settlers here in this country, and that we have we share this place with many people and many living beings. As Indigenous people and many animals and plants share this land with us. So, to me, the acknowledgement is an expression of gratitude and appreciations for those whose territory that we work and live on, and a way of honoring the Indigenous people and all living creatures and beings who have been living and working on this land from time immemorial. So with that, thank you. So what we would like to do today is to give a presentation, roughly about 14 minutes between two of us, and then open for question and answer. So to start with the discussion, I'm not able to move this forward. Oh, I see. Oh, okay, thank you. So I would like to first set some context to this project. Just wanted to say that this is a project that came out of the Royal Society of Canada's One Health Task Force on care and climate change policies. We were asked I was asked to put together a team to sort of think about and examine care and climate change policies about a year and a half ago. And so we came together, a large interdisciplinary group of us, and we began working since last summer. So we have this we have a time frame of anywhere roughly between 2023 to 2025, 2026. There are 13 people in this team. They're all we're very interdisciplinary and intersectoral researchers and policy experts. And that in addition to the 13 task force project members, we also have, in addition to the 13 project team members, we also have been working with the support from the IDRC, Global Affairs Canada, ECCC, Statistics Canada and the various offices of principal and president at the University of Toronto for this project. Basically, there are three aims to this project. First is to really undertake an in-depth conceptual and empirical analysis of care and climate nexus through this interdisciplinary and intersectoral collaboration. Second is that we will develop a package of policy briefs called Intersecting Care, Climate Change and Care, a policy brief package to solve global climate change and climate change issues with care. And in this package of policy briefs, what we're trying to do is to look at provide policy briefs and look at different dimensions of care and climate change in a very compact, concise way so that we could communicate to policymakers, NGOs, and other key social and economic actors. And then a third objective is to use this as a as a basis to really communicate and disseminate our work to much wider audience through different kinds of information and communication channels. So these are our three aims of this project. So for this presentation is that the first part of the research project. In order to develop the policy briefs, what we did was we met together earlier this spring, starting with a kind of analytical framework to help individual members develop policy briefs and set a sort of framework to analyze care and climate nexus and some of the tools and strategies to develop that policy analysis. So for this, for that, both Shawn and I developed a kind of conceptual or analytical framework to look at care and climate nexus. Mine is called my conceptual analytical framework was called From the Care Economy to Care Ecology, and it provides an analytical framework. And what it tried to do was to provide a kind of initial analytical framework for intersecting care and climate change. I presented this to the team in April this year. What I realized is that I was being a sociologist coming from the care economy side of the research. This was very much sort of an analytical framework that came from the care economy perspective. And I received a lot of comments and feedback from the team members saying, oh, you need to push that planetary boundary a little bit, bring in much more ecological perspective. So I went back and redid and revised this in the second draft. In the meantime, Shawn was also working on this and building on the care economies perspective, but adding much more ecological dimensions to the framework. So today what we'll do is we will sort of both share our two sort of perspectives, and hopefully I think these were actually our frameworks actually merge very well together, but we'll have that discussion and share with you. So let me say a little bit about the sort of care economy and care ecology, my analytical framework. So the rationale. So I start by talking about why we need to intersect care and climate change. And of course, the rationale is that care and climate change crises are not only occurring in parallel with each other, but they are actually very deeply intertwined and mutually exacerbating each other. This is because care and care work. So on the one hand, care and care work are a very integral part of the national and global economy, even though much of these activities are social, even though much of these activities are socially and economically invisible and largely not accounted by the national economic accounts or included in the GDP. So what we know from our experience with the COVID-19 pandemic was that it really made it clear that without care and care work, children were not able to socialize, learn to grow, and be productive members of the society. Healthcare services were overwhelmed, overburdened. Sick and older people died early death, and people with disabilities had to manage on their own. So the social and economic costs of not having care was huge, and we know this. And yet, on the other hand, similarly, a similar argument could be made about the climate. Like care, the environment and unharvested natural resources are not counted as an asset in national economies or in our GDP, despite the fact that they play a very important part in supporting our countries and people's and animals' health. Yeah, and as well our social and economic well-beings. So as a result of this apparent invisibility, both climate care and climate change have sort of remained outside of the outside outside of their sort of remained outside and separate from the mainstream economic policy and research. And not only that, because of their different sectoral and disciplinary orientations, the two policy and research sectors have been really operating in separately in silo from each other. And of course, this has contributed to a sort of very inadequate understanding about the sort of about care and climate contribution to individuals, community, national and social well-being, and how they're kind of linked together. So the rationale is fairly clear that we need to bring these two together. These two, care and climate change, are therefore really deeply intertwined with each other, because climate change is directly connected to increased demand for care, in addition to the immediate and long-term physical infrastructure disruptions. We have the impact of climate change in terms of increased population health risks, food insecurity, displacement and forced migration, economic and employment losses, increased resource competition, and social and political conflicts. And all these result in increased demand and need for physical, mental, and material care. So these two are really closely intersecting with each other. So for this care economy to care ecology analytical framework, what I did was to start with the WHO FAO's One Health concept. Basically, this concept has been around since 2002, very long time, but it's been really developing over time after each big healthcare crisis. But basically, what this concept says is about kind of interspecies and ecological interdependence. What they try to do in the One Health is to sort of look at this whole thing as a kind of ecosystem. So as this quote shows, they argue that human health and health of domestic and wild animals, plants, and the wider environment that includes ecosystems are closely linked with each other and interdependent with each other. one of the problems with or limitations of the One Health concept is that while the framework of interspecies interdependencies is really, really good, it actually lacks clear framework or analytical methods or strategy to intersect these sort of and intersect and analyze these key variables. So when you go about to do the analysis or research on how exactly do care and climate change kind of intersect, aside from the fact that we're all interdependent on each other, it doesn't say. And it's mainly because this is largely a sort of call to action framework, policy framework, not a research framework. So we need to go back and really begin to look at that analytical strategies. Second sort of limitation, I think, of the One Health concept is that, well, it does mean, well, it does seem to tilt a little bit toward healthcare and kind of overemphasize the health and healthcare dimension of the climate change and downplays other climate changes, much broader sort of material and social effects like food insecurity, like conflicts, resource conflicts, that kind of thing. And like migration, how do we understand that? So we need to push that boundary a little bit further. And in addition, as I mentioned earlier, the One Health concept also need a little bit more sort of additional sort of perspective on social and ecological systems. So in my revised concept, I actually add in sort of additional perspective coming from the sustainability and resilience literature to look at why we need to intersect care and climate change and how that care and climate change nexus might figure out. Now, I'm going to do very quick overview. There is if you are interested in reading the draft, I would be happy to share, but it's a fairly long document. But just in terms of the conceptual framework, I just wanted to very quickly go over. I start with the concept, Shara Razavi's concept of the care diamond, where she argues that care is provided through the kind of through collaborations of four key sort of socioeconomic institutions that of the family, the state, community, and civil society, and the market, and depending on the society's time and context, these four socioeconomic institutions like configure with each other to provide care for within our society. And which is, I think, is a very, very useful and powerful framework to start with. It has a direct policy implications because the policies can affect the configurations of these institutional partners in providing care and how they get provided, who receives and provide care. Now, this needs to be, although hers was very schematic in terms of institutional configuration, what we need to begin to see is how this begins to sort of shapes in the multi-scalar perspectives. So we think often of care, particularly in context of climate change, begins with immediate community and family at the local scale, at within the community or at the municipal city level, and how that in turn intersect and communicate at the national level in terms of the policy and program interaction, and then scaling that further back in globally, as there are different global, national, and local municipal institutions and policy bodies that are really working on this, often in collaboration with each other. one of the addition to that after the first meeting was that we need to really expand that further to look at broader environmental sort of planetary dimension of that framework. So this is the revised sort of integrated conceptual framework for analyzing care and climate change. So we see care and climate change as embedded within, not building beyond the care diamond, sort of embedded within 5 different sort of aspects of family, state, community, and civil society, market, and the environment itself. And many people in the team all talks about the importance of embedding environment as one of the kind of socioeconomic institution, because environment, we're not only sort of impacting environment, but environment as a caring sort of entity would be important. So we moved from the kind of the care diamond to care pentagon. Sounds terrible. Care star pentagon, and then again pushing that up, applying multi-scalar perspective, starting from local all the way to the planetary level in our analysis. Having said that, how do we exactly then sort of try to distill this into individual sort of policy briefs? So here is the sort of analytical strategy that might be useful in sort of in analyzing care and climate sort of policies. So what we do in here is that we start with sort of a review of the existing climate care impacts. So we have done, and every one of the people in the team have done a very thorough review of the literature on different dimensions of climate and care impacts on community, on society, on individuals, family, and on economy, and then separate out, because we can't address all of this all at once, separate out into, now it is still 4 sort of large institutions that came out of the care diamond concept, separating that out, market and and then apply that lens to look at the climate and care adaptation and mitigation strategies and analysis. And so in the process of doing this, we also want to look at some of the key variables that might influence and impact, and that we might consider as we analyze climate and care policies. One of that would be socioeconomic and socio-demographic dimension of this. Another one would be economic dimension, infrastructure, governance and ethics, community and civil society, and environment. So putting these lenses that different project members have actually developed and drafted their policy briefs, and then in which we will be talking about how we can, what we need to do in order to sort of achieve the kind of climate and care outcomes that we're looking for, and then assess those outcomes as we go. So I am going to stop here. I mean, this is very conceptual kind of conversation. Happy to answer questions later, but I think at this point I'm going to pass to Shawn, and he would pick up from where I left off. Thank you.
Should have been watching.
Just.
Okay, perfect. So thank you, Ito. It's a perfect introduction, and I can skip some of what I was going to talk about. You've laid that foundation nicely. I should start by saying I'm not quite out of my depth here because I'm just a climate scientist, and I hadn't thought or even heard of the Care Climate Nexus until we all gathered, and several of you in the room in April here. I think it was the same room. And I'm now captivated by the problem because I can really see these intersections between climate change and care, and see that it's a bit of an invisible nexus that hasn't received a lot of attention, at least from the climate science community. And I think also within the care community and the care work, there hasn't been a formal structure for bringing in environment, bringing in climate change. So this is like early stages of something which I think is very global. It's very significant. And it's been really fun for me to get to work in this problem. So my background is as a climate scientist, and I've done work with climate modeling and contributing to the IPCC intergovernmental panel on climate change reports. And when I first kind of came into this conversation, Ito invited me to join the group. I was almost a bit surprised and thinking, well, the climate community's probably thought about this somewhere. So I kind of started with scanning for that, and that's a bit between the cracks, I think. And most of you are here because you probably know this much better than I do. You can find lots and lots of graphics like this that talk about social, economic impacts, healthcare impacts of climate change. And these are getting better and better developed. Initially, if you read early IPCC reports, it was just about the physical climate system. And with time, they've brought in more and more socioeconomics, and people have come to the equation. There's people involved in climate change now that might not have been there in the very first report in 1990. But if you can see the fine print here, things like migrations from rising sea level and displacements associated with climate change, instabilities that might arise through geopolitics, sustained drought and food insecurity, water security, supply chain impacts like we saw in COVID, which really can, and natural disasters and extreme weather events can really destabilize those, not just in developing nations, but we've seen that a lot in Canada, way too much in North America in recent years, from wildfire and hurricanes and floods. And it can really knock out the support systems for care that Ito talked about, public, state supports, as well as household impacts through that. Disease, water supply. So lots and lots that's represented here. The climate community has been interested in tracking, thinking about, but you don't see the word care here. It's not necessarily in that care context. And so a lot of these ideas were things we talked about as a group in April. So you'll see some recurring themes. One of the things we talked about was how much does IPCC engage in care and unpaid care work? And most of you are probably familiar with IPCC. The very first report I mentioned was 1990. I happened to be I'm dating myself, an undergraduate student at U of T at the time, actually, and I was taking a fourth year course, this is 1992, fourth year course in climate physics, climate processes, with a guy named Dick Peltier, and he gave us the first IPCC assessment and said, here, everybody read this, we'll talk about it next week. And it was maybe 300 pages. You could actually go through the whole thing over a week and talk about it over the next couple of weeks. And that would be impossible now. I don't know anyone that's read from start to finish the whole of an IPCC report. So just a couple of years ago, the 6th assessment report came out. They do this every 6 or 7 years. There are now 3 reports. The first one is like the physical climate system, and that's the one I've been part of as an author or contributor. The second one is on impacts and adaptation, and that's where this work will fit. The third report each time is on climate change mitigation, which is on reducing emissions and natural carbon sinks. And it's a bit relevant to this, but the care work and health is really in the world of climate change impacts and adaptation. The 2022 report, there was more than 3,000 pages in that. So total, if you put all the volumes together, it's more than 10,000 pages, all the IPCC volumes, with countless references. It'd be really hard to be on top of that. But even within those 3,000 pages, there's only one reference to unpaid care care work here twice, and care in the summary for policymakers, which is a shorter condensed version. Care just go with care only appears once. So it's really true that it's not been given very direct attention. It's not like the things that climate scientists are thinking about aren't relevant, but they're not specifically thinking about care services, care work. I don't think many climatologists know of the Care Diamond. I heard of it for the first time in April, and thinking about these things I think it's going to be really helpful to engage in the climate science community to get them thinking about this. This is around Millennium Development Goals. It's not care again, but it's obviously huge intersections. And it's kind of a nice matrix where down the vertical axis, the y-axis, you see different impacts of climate change, potential consequences of climate change. And there are scenarios for all of these going forward in future decades that the IPCC tracks and climate scientists are modeling. And then going across, you have different Millennium Development Goals, and it's just a question of how a different climate change impact, like drought or natural disasters or water stresses or migrations, will have negative or potentially positive, but mostly negative impacts across different Millennium Development Goals. I can see a matrix like this being really helpful for care work, where across the top you have different elements of care and how they're vulnerable to different elements of climate change and different impacts from climate change. So it's the kind of thing that can help to inform the kind of care climate nexus we're trying to wrap our heads around and make it a bit more real, at least to climate scientists that are trying to understand. So how you can intuitively understand that climate change and impacts like severe weather events and displacements have huge negative consequences for care, but it's hard to isolate that and really understand exactly what it is. And so within climate models, most of you know this world a little bit, and you've seen these kinds of graphics. They tend to track just meteorological variables, but maybe soil moisture and agricultural crop yields and forest migration and things that are pretty relevant, but they focus mostly on temperature, precipitation variability scenarios going forward. You could look at 2030 or 2040 or end of century, lots and lots of dire warnings about increasing propensity for drought. That's what this is showing. And it is pretty clear that dry parts of the world are getting drier, and that we'll probably see a doubling of water resource stress as these decades go on this century, which will really exacerbate care and health in large parts of the world, but it's very uneven. It's very locally, regionally distinct. So that's one of the challenges, and that was in your graphic. The concentric circles, that the local and regional, it's different reality. Just as care systems are different everywhere, the impacts of climate change are going to be different everywhere. But there's the scenario, they're there, and we can work with those. It's kind of a question of how do we engage in the climate science community that's producing scenarios like this. And I think healthcare community started to make inroads here. There might be an example like air quality health index from wildfire or heat stress index. Those can be found in climate models, but climate modelers weren't producing them. They're not there as, you don't see a plot of that in an IPCC scenario. But if you tell the climate scientists to track the number of consecutive days over 32 degrees or whatever is the critical number for physiological heat stress, they can pull that out of the models and track it and make graphs of it and global maps of this. So if there are similar variables in the space of care as a community to think about, that could really help to actually get these, to get climate scientists thinking about this a bit more. And I mentioned that I think maybe a bit recent, the past decade, but the health sciences community has made good inroads with the climate community. And then in that same IPCC report, there's a whole chapter 7, dedicated to the intersection of climate change and health, so the climate health nexus. And care probably fits within this. It's a lot of the same language you can see here would be very relevant. This is a direct quote from the executive summary of that chapter. This can map a lot of this onto care, but it's kind of a question of where we live within this climate community. So that's something since April, we first convened, I've been trying to think about it a little bit. How do we bring this dialogue more into the consciousness of the climate science community, of IPCC? Is it helpful to bring this to the climate COP meetings, for instance, and try to bring just more awareness to this climate care nexus in a similar way to the health sciences community has done with their publications. There's annual publications in the Lancet where they really develop in a lot of detail the health climate nexus. And that helps because to get recognized by IPCC, they really are restricted to, are told to work with the peer-reviewed literature. It's an assessment. It's a lot of online documents, gray literature, policy papers, or policy pieces. IPCC probably won't be able to make use of those. They really need that peer-reviewed literature, and the health sciences communities managed to do that and really establish that. And this comes back to a lot of Ito's points, and so I don't need to elaborate this too much. As much as climate science communities not been thinking about care directly, only implicitly, I think that within care work, care provision, there wasn't really a good place. An environment, the care diamond is very anthropocentric. There's no real place for the environment or nature as a provider of care. The provision of care work from nature and environment was kind of missing, and that's something we really realized. All of us were going a circle, going, yeah, that's true. Where does the environment fit in this framework? So Ito's graphics are like towards bringing environment into that, and it's easy to document that. A lot of the policy briefs have gone that route, where you could see how the environment provides food and water and medicines and physical and mental health support, and you can. It needs to be very carefully documented, and it's probably a complicated global picture, but it's easy to think of how environment is a source of care, as a provider of care. Ecologists call this ecosystem services, and it's been in the literature for quite a while as services provided by the environment. Environmental resources also provide support for economies and for the public and state and market sources of care, provisions of care. So if you start to embed environment directly into as one of the providers of care services, then you can also have a place for climate change or environmental degradation, because you can start to lose that. So if you've got a sustainable, reliable source of water or food or agriculture, climate change causes that to go away, then that's going to impact directly on care. And so having environment as one of the providers of care and a kind of a care star configuration lets you capture that pretty well in a framework that we're vulnerable to this, and climate change might really exacerbate stresses on the provision of care. So we played with different things. These are really oversimplified versions of what Ito presented, but one simple way is to wrap the whole care diamond in environment and bring in ecosystem services or natural capital, bring in climate and security. I put on the outside here, and by that I mean security of water, food, where you live, that it's not being eroded by sea level rise that would eventually give rise to migration, which completely undermines care services. There's security in the Canadian context. If you live in Western Canada right now, and wildfire and flood hazards and dislocations and displacements, a lot of people in Western Canada have not been able to return to their homes in the past 2 years still. And so it's a huge disruption. So that's one way just to bring environment into the conversation. I think I liked your centric circles. I put a star here to think of environment as directly, but I think, and maybe it's helpful to think of it as a star rather than a pentagon. Pentagon's a bit too but I think that the concentric, the overlapping circles are nice because all of these care providers, so putting environment together with families and households, market, community, and state, directly captures how the environment contributes to care services. But these all intersect and they overlap each other. So environmental change, like natural disasters, can wipe out market and state support for care in the event of supply chain disruption or migration, or power goes out, or a whole community is displaced. That takes out not just households, but all the other sources of care. So there's lots of interactions that need to be captured, not just a simple star here. So most of this has been about how environment and climate support care. And I noticed, I didn't clue in exactly to this, but your Royal Society charge is about climate policy, which is different. least to think of climate change and climate change policy is the same thing, but they are fairly distinct. So there's the physical changes, all the disruption we're facing to do with climate change, and that has very direct and indirect effects on care and the other sources of care provision. But there's also climate policy, and a lot of that happening right now, whether it's climate change mitigation, so reducing emissions, or investing in natural carbon sinks, or preserving carbon sinks, like paying large regions not to deforest. Those are all climate mitigation policies. There's quite a bit of funding coming through those, through the little symbols, the Green Climate Fund. It's part of the Paris Agreement, United Nations Framework Convention on Climate Change funding for climate finance. Lots of programs, including pretty large Canadian contributions to this. I think in Canada has been helping with this. I think it's 5.3 billion over 5 years, Canada's contribution to this international climate finance. Big dollars, and you could use this well or you can use this badly. It's really big opportunities to think about in these climate mitigation, climate adaptation projects that are being implemented. How can you build care very explicitly into those projects? So that's, you need the first part. You need to understand how climate change is impacting care, but then you can start to think about energy projects, urban design, how maybe there's unintended consequences of climate mitigation projects involving natural carbon sinks, for instance, that propagate down to impact care provision. To be very careful and deliberate with a kind of a explicit care lens to actually think about how a given intervention might impact local and regional provision of care. Lots of intersections in climate adaptation initiatives on provision of food and water security and reducing household level climate change impacts. So I think bringing a care lens to the policy is maybe it's a next step, but it's a separate step, but they both need to go forward together a little bit. So documenting the care climate nexus in terms of how climate change impacts care, but then thinking about it in a policy frameworks is a very deliberate lens, the way we're used to thinking about. Still need to do a lot of work on, but we're used to thinking about equity lens, gender lens. Should also be a care lens built into a lot of these policies. That's all I really wanted to present today. It's very resonant with what Ito says. I think we're talking about the same thing, very similar ideas here. I think there's interesting in this policy space, thinking of moving forward with climate change mitigation, adaptation policy, also loss and damages policies and funding. I think there's a really good chance to build in multiple values, and this is starting to happen in biodiversity conversations. So in Canada's global responses to the new global biodiversity framework agreement, which was the top meeting in Montreal a couple of years ago. I think that COP16 is happening right now in Colombia. They're talking about these things of not just biodiversity benefits, but climate benefits, equity and environmental justice benefits, health benefits. I think we're slowly getting to understand that we need all of these lenses in our policy space to make really effective policy. There's opportunity there. And within that, we maybe up to our community to find some care-centered metrics. That's all for me.
Thank you. Thank you. I just want to add to Shawn's summary points that, the Royal Society of Canada's, task force on care and climate change policies was a fairly specific task that was sort of asked of us. But in my mind, and I think the team members also agree, that we could use this as a basis for sort of further, much broader and more in-depth sort of analysis and project on sort of care and climate change as a whole. So collecting data, documenting and analyzing the impact and implications of care and climate change and moving forward. Certainly in our previous meeting, we did talk about, sort of, yes, let's start with this package of policy briefs that we have promised the Royal Society. But we shouldn't be just stopping there, that because these policy briefs actually serves as a basis for much larger articles and papers that we could and we want to write. And so we were talking about sort of longer term projects of really working together and really trying to understand care and climate change nexus. So this is a way of saying, we just started this project. I think it's a really interesting project, and we're getting a lot of interest from different sectors, of society, community and society, different levels of sort of governments as well. So in a way, this is an introduction to our project. That if you're interested, do contact us and let us know, and perhaps we could, find ways to work together. But at this point, but I just want to open the floor for questions and answers, comments, whatever, if you have any. Yeah.
Hi there. I just want to say thank you for doing this work. I think it's really important. And I know, like, having worked in climate policy, we talk about climate health, but not necessarily the care economy related to that specifically. I just wanted to ask, I guess it's a two-part question. One, capacity, because I know that climate change brings on, in my opinion, a series of mass disabling events through pandemics, through disasters, which will impact elderly people the most, racialized communities, indigenous communities. And I also know that these groups are most likely to be the ones that are working in the care economy, which is not necessarily the most glamorous work, so to speak, and doesn't necessarily attract many participants. So in terms of an already aging population, and then the increased levels of care that's going to be needed as a cause of climate change, how are we going to deal with this? And then do you see this as a means, I suppose, of linking these two issues together as a call to action for both then climate change and the care economy? That makes sense.
I think it's your space.
Yeah, thank you very much. I think you're raising really big issues, and I think that other people, members, feel free to comment. But I think sort of that I think the climate change and what you're saying is that in fact climate change and the care economy seem to be kind of sort of that not only intersect with each other but opening spaces for sort of lots of different kinds of actions and ideas to flow. Certainly, that climate as you said, climate change really impacts, the sort of vulnerable population, a certain demographic group, and that we need to think about that. But there, and therefore, it actually intersects with the care economy as a much more directly and very closely. And so I think what you're raising is that this gives us sort of way to think about more broadly, not just about sort of how climate impacts care work and care work, but also how sort of climate and demographic changes, right, are sort of serve as a driver of sort of care and care economies. And I think in that we're maybe looking at both sort of challenges and opportunities, right? Opportunities, challenges in the sense that I think we could anticipate that the demand for care is going to continue to increase. Whether that's directly resulting from climate change or from other variables like demographic shift, changes in sort of the way people work, changes in gender relations, changes in household, family household structures. So that challenge is how to address that. But then the opportunities might be, there are some feminist economists who would say, this care economies might be one of the solutions for green economy in the future, because, you know, care and care work is relatively, as compared to other sectors, you know, carbon footprint, low carbon footprint, and that if we could sort of bring forward our recognition about that care and care work, and sort of really sort of work to redistribute and redistribute care work, not just between men and women, but between different socioeconomic institutions, like from families to the market to the state and all these, and recognize the value of care work, then we might have, you know, we might see as this might be the seed of the new economy that could, you know, help us move forward. So I think there are a lot of potentials, I mean, and challenges too, because for us to get from point A to point B, there's a lot of sort of value, economic, you know, political and policy transformation that must happen. But that might be an interesting journey for us to take. So yeah, thank you for raising that. I guess I'm not sure whether I'm answering any question, your question, but I think you're identifying that this might be the sort of a way to look at much larger issue.
I would just add, Celine and the group has been thinking about demographics quite a bit, and so but you're pointing out a really challenging mapping, because I think it's pretty well documented, the differentiated impacts populations on women, on in different parts of the world, and indigenous populations, and then it needs to be mapped within those populations. They are probably have an over commitment to care. They're overrepresented in the unpaid care services as well. So like, I think that link is real, but it will take some work to really map that out, but then understand where things are going to in terms of some parts of the world, aging populations with probably less reducing childcare needs, and other parts of the world the opposite. And so it's a super difficult challenge. But the link is pretty strong between climate change, differentiated impact, and care.
So I'm also I noticed two hands up and the virtually, but I also want to ask Celine if Celine is Celine's not here yet. Yeah. Because she wrote about the demography and climate and care so intersection. Actually, brief.
Yeah, go ahead and if you want to chime in on this.
Celine is joining us virtually. Celine, if you want to have any comment.
Yes, hi, sorry. So I think that the demography and care are really, demography is driving most of our care needs currently because of the enormous fluctuation, the rapidity of the evolution of the demographic trends currently. So it's very important that as we reflect on care and demography and care and climate change, that we really integrate demography, and we have a tendency to not do so much. So I think that's one important point. Another one is that demographic trajectories are influencing climate change. It's not only how our care, the care sector is going to be influenced by different demographic trajectories with aging population, different family structures, etc. It's also how much these demographic trajectories have very different environmental impacts as well. And these are very difficult. Again, it's a super complex issue with many things to untangle, different roles of how much population growth influences environmental sustainability versus consumption, etc., things like that. But I think that it's important that we take into account the drivers of those demographic trajectories as well. which include gender equity, education, and reproductive autonomy in particular.
Thank you, Selene. And I see two hands. Marina Durano, could you identify yourself and as you ask questions or comment?
Yeah, hi, good afternoon, everybody. I'm Marina Durano and currently a senior director at the Collaborative for a Gender Just Economy, which is being hosted by the Global Fund for Women. Just want to thank you very much for your presentations, Ito and Shawn. And a little observation here. I think there's something implied in the frameworks which has to do with time, but particularly the relationship between generations across time. Right, because obviously when we care, we're caring about the future generation, but also the previous generation. There's an intergenerational relationship, but clearly with climate that is true as well. I mean, the youth movement has made this kind of like their main focus of their demands is like what's going to be left for us, something like that. But the financing question is also a time question. Do we save now and spend later? Do we borrow money to fix whatever needs to be fixed? You know, mitigation, adaptation will cost money now. But what does that mean for future, you know, financing options, etc. You know, so I think there's this, and that goes around, right? In terms of all the different spheres, you have an analysis or a framework that goes across space over various thematic issues, but actually we're also talking about intergenerational relationships. Let's say, you know, what now versus tomorrow is sort of, that's part of the dilemma and part of the pressure to find solutions. So I just thought I'd raise that up because it actually matters in terms of the when question. Yeah.
I think you point out a really important issue, and I think sort of many researchers have been kind of trying to look at, trying to argue sort of investment, you know, that care and climate as a form of, you know, social and economic investment for future. I think it'll be really, I think this is a dimension that we really need to really work on, and something that in which I think it'll be really good to have a good sort of both macro and macroeconomic sort of analysis of cost and benefit. You know, expanding, you know, expanding, say, 1 generation, 2 generation of investing in care and climate. Yeah, so thank you for pointing that out. Maria, I think, could you identify yourself then? Thank you.
Yes. Hi, how are you? I'm Noni Estrada from the United Nations Institute for Social Development. The Research Institute. Yes, I'm sorry. I'm having problems with the internet, so I think I will take my video off because I'm in Panama. It's raining a lot, and I'm afraid it will cut the internet. So, well, Ito, it's nice to see you again, and I'm fascinated by this because we are also developing a conceptual framework on climate change and care, and we are doing this with also with the support from IDRC, and I think we talked of this when we met in New York in March, and we have this climate and care initiative that we are working with Avina, Oxfam Canada, and the Global Alliance for Care with the support of IDRC, as I told you, and we are working on this conceptual framework also, and with a different approach, but I see lots of similarities, and I really like this, and I want to make comments on what Shawn said, what you said, what now Marina said also, but I will focus on, I will just say that our framework begins, we acknowledge this overlapping crisis, as you said, and what this happens is that it intensify the environmental degradation and extreme weather. So this is placing new demands on our care systems that were already in crisis due to the increasing needs and chronic underfunding of historical, you know. So these pressures disproportionately affects more women and girls, as we know. And why is this important? Because this nexus approach that you mentioned and that we are using also makes that we treat this crisis, and it's not only climate change and care, it's all the crises that we are facing in the world. And as CEPAL Clark says, it's a cascade of crises, no? So by addressing these crises together, we try to build more resilient scenarios, and this help us have a more holistic approach. What is central, and I wanted to say now, is that our framework is based on the care diamond that Shara Razavi, that was for UNRIS, developed in 2007, I think it was. It initially conceptualized and illustrate how care work is distributed among these actors, and today we are adding new intersections there. So this means that we now is different the way we care for people and the environment and the planet, and this needs to be integrated and reflect this shared responsibility across sectors for humans and the planet, no? So I agree with you. I think we have a really short time, so we need to focus on policies that recognize this unpaid care, create green jobs, and prioritize women's role in resilience building. So this can be done by taking a feminist lens on climate justice that sees that this climate care nexus is a pathway to social equity. So by saying this, I think we should discuss more about these frameworks that I think adding the environmental dimension to the diamond, and with another approach that we are developing now, that is amplifying the diamond to a prism, including more dimensions there too. I think we should talk more and go deep on these new ideas together.
That's great. Thank you very much. And I see Pilar's hand and Fiona. Okay, Pilar, go ahead. Thank you, Maria. I think that you have a really good point.
Thank you so much for the opportunity to contribute to this discussion. I would like to emphasize the critical importance of integrating disaster risk reduction within the care and climate change nexus. The UN, you know that UN is currently working in this integration, and climate disasters not only disrupt essential services. So the women, children, the elderly, and people with disabilities. So I really want to emphasize in including disaster risk reduction actions and their integration with climate change adaptation, especially. Thank you.
Pilar, could you identify yourself, please?
Oh, I'm sorry. I'm Pilar Medina. I am an urban planner from Colombia, and I work as a consultant on gender issues in disaster risk reduction for the UNDP. Thank you.
Thank you. Thank you very much. I think disaster is definitely one of the issues that we need to integrate in our conceptual framework and thinking too. Thank you. Fiona?
Super, thank you. Fiona Miller, I'm a professor here at the University of Toronto and direct the Collaborative Center for Climate Health and Sustainable Care, also run a national initiative for climate action and awareness in healthcare funded by Environment and Climate Change Canada. So my personal work, although I'm interested in a broad range of issues, is a little bit more about health systems and some of the formal care. So sort of a question and comment reflection on that we've talked about before, that I think the care diamond and much of this work comes out of informal care and a focus on unpaid care, which obviously needs real focus and elevation. But I guess there are critical connections with the formal system. And speaking from a healthcare perspective, much of the, say, WHO's work on this is very health facilities. So it's an incredibly narrow piece of the healthcare system. Good health systems are health and social care systems. And of course, that's just one piece of formal care systems, educational systems, all of the other kinds of daycare. There's many, many systems that are formal care that intersect with informal care. So I guess it's it's sort of a question, how far is your framework attempting to go? But I guess it's also a comment, because I do think that so some of my work in this really is trying to elevate beyond the facilities. The farther you can get us thinking about formal care systems that gets into primary care, community-based care, integrated health and social care, the more resilient you are, the lower impact you are, because you're elevating some of these high touch. So it's a sort of a question and a comment about what is where are you trying to, in a gray way necessarily, draw the line or the parameters around what your focus is, and what are the opportunities to strengthen the work that some of the folks on the formal institutions are trying to do, to elevate attention to the connections to informal care and the more community-based community-led work that we all know often gets disadvantaged, but really does need elevated.
Yeah, I think that's a really good point. And, we get often asked sort of, when you say care, how are you defining, and like exactly your point, like how far, what are included in that? And I don't know what other people thinks, or what other members of the sort of team thinks, but in my mind, I see both informal and formal care as a kind of two sides of the coin, but they're mutually dependent on each other. It's like you have informal because the formal is not addressing inadequately all the care needs. But also there are sort of really good reasons why informal care happens. But I think they are not mutually exclusive with each other. So in my mind, the way I like to see care is to bring them all together in an inclusive way, to say formal care, informal care, just paid and unpaid are really sort of the mutually interdependent kind of that part of that overall care system. I also absolutely recognize your point that even within the formal care system, you've got it's very multidimensional, that ranges from extremely highly formalized formal all the way to informal formal kind of community-based care that you're talking about. And how do we elevate and bring them together? I think the strategy is actually, while recognizing all these multiplicity and multidimensional nature and aspect of care, I think we need to talk about them as a whole, as an ecosystem. Just as we are talking about care, climate change, economy, society as a one large ecosystem in which we have to address them, not in isolation with each other. I think it's important to think of care not as formal care, informal care, community care versus hospital health care. It's one ecosystem that we need to address. So we can't think about sort of policy in one part of the care without thinking about its implications and impact on another parts of the care. So that's how I see it. I mean, I'm open to other, thoughts and ideas.
I don't know that I have a strong view on this, but in our conversation so far, it's been, I like the way you've kind of described it as the social components of care, and this is probably the focus here, and that does intersect with formal care systems and community health and daycare and residential care for elderly, and so I think that's where we intersect nicely and should be working together, especially because the climate change impacts will be very similar on both sides of that, but then infrastructure, or maybe another right word for it, kind of epidemiological considerations or physiological heat stress or things like that are not kind of in our purview, but would be within yours. But the social dimensions of healthcare and the community health systems, there's a lot of synergy there.
Yeah, Martha.
Thanks. Just to add on this point, and then I also want to point to like other work, complementary work that we're supporting at IDRC. So I think on the formal, informal, one of the things that we are also very interested in seeing is how climate change is disrupting the care ecosystem. So I think we might likely see more like the constellation in a particular locality shifting because of maybe in some cases, I think when the formal structures are strained. So we might see more reliance on informal systems and structures that we didn't before. Migration might induce that when you're flooded with new migrants because of migration, and the formal care system cannot support what happens, and is that shifting to the community? So I think the sort of the correlation between that and how that is changing because of climate change is also really interesting, at least for us. I also wanted to say, I think, one of the things that we're really keen about this is, and as you both mentioned, I think they were so far to the extent that we're looking at this nexus, it's always been a call to action, more of a call to action, and this is really, happening, and it's interesting, and we need to do something. But I think what we're doing here, what you're doing, is put more rigor and actually make that more defensible, so that when you're speaking to climate scientists, you have the data and science behind it. So right. So in addition to the unrisked work that was mentioned, so we're also supporting a team at University of Toronto to look at it from the global South perspective. Is this, do we see a different picture actually when we're looking at the care climate nexus? So one of the things, and very similar, one of the things that maybe is more prominent there is sort of the rural urban location matters a lot, because the kind of care that mostly unpaid, largely informal in those contexts, but sort of how climate change is disrupting that care system in the rural is very different in the urban area. So that sort of locality becomes much more prominent in those contexts where, it's informal, but also like the impact is very different. So I think it would be interesting to actually at some point see how the different patterns of the nexus appear depending on, whether you're looking at different contexts, like how like when you've seen the map, how climate change is impacting differently across geographies. I think that nexus maybe plays out differently, right? I think it would be good to kind of bring it together and see what are the different ways in which that pathways are impacted.
Thank you. I think that's a really, really good point. And I think there were some people from the University of Wits participating in virtually. I think it's very late in their time right now. But yes, I agree completely. Sort of looking at the care and climate nexus context in different regions would be very interesting. I just spent, a part of September in Mongolia, where, the urban rural, and partly because of the migration, partly because of the different impact on their agricultural economy, very different sort of ways in which climate is impacting. And so in Africa, in Latin America, in Asia, I think looking at that different contexts and urban, rural, but also other kinds of dynamic is really, really important. I see Fabio and Dawn. Fabio.
Yeah. So I think something that comes up to me and kind of ripples through all these conversations is really kind of this data and science discussion and how we integrate that into the discussions of care. So I think something that's really fun looking at the presentation is like, well, we can track soil water levels, or like we have a lot of quantitative measures for environmental things. But when we're trying to bridge these data that capture both care and climate, where are the areas that we can see, like what data is compelling, both from like the social science perspective, but also the environmental science perspective? Because I think like these are two subdisciplines that have trouble talking to each other. So are there data routes forward that we can kind of see where we can start building data profiles, or what kind of compelling cases can be built with data going forward?
Yeah,
That'd be really good.
yeah. I think that's a great, I mean, that's something that we've been talking about, and other members of the committee, please feel free to sort of raise your point. Some of the things that we've been talking about in terms of the data, you know, or not just in terms of the sort of heat maps and heat data and number of people, you know, the number of people impacted by, but for example, I have some data from the usage of hospital usage and admission rate, you know, in a particular, in particular sort of heat waves in Quebec or Canada and that kind of thing. But some people have also raised, well, what if we have kind of GIS mappings of, you know, sort of GIS mapping of the heat patterns into overlapping with the, you know, like childcare deserts, elder care deserts, and, you know, within the like urban centers, right? So that, you know, like so that you could geolocate where the demand, you know, where there's a kind of vulnerable points of vulnerability within the city and that kind of thing. That requires, you know, that means engagement with urban planners and, you know, geologists as well as the scientists. And so I think that there's a lot of data, and I think one of the tasks that we must do is really begin to identify what data there are, both administrative and statistical and geographical, and see how we could kind of begin to intersect them together. So that, I think that would be really interesting. Anybody thoughts?
That intersects nicely with Martha's discussion of urban, rural, and the maps. And you're gonna start to imagine if we know what are the key data sets, then you can have time series, which are really powerful, but also these very visual spatial maps, and see those intersections. It kind of works in an urban context, but also in a very rural, global south context.
I see Dawn has her hand up.
Hello, everybody. I'm going to put my hand down first. Thank you very, very much for all. Actually, I don't know if you saw the chat, Shawn and Ito, but I said thanks for a great overview. That was lovely. And I just want to say, I can't remember anybody's name because I've been doing 15 things at the same time while listening in. The issue of space, the spatial variation, particularly with regard to urban areas around the world, I think is really important. I'm Dawn Baisley. I'm a biology professor at York University, but I'm spending the academic year on sabbatical at Yale, which is why I'm zooming in. I'm not there in person for that reason. And my particular paper, or one of the two that I'm co-authoring, is actually on the intersection of climate change and care in urban environments. And because our task was to write policy briefs for Canada, and these are very, very short papers. Honestly, Ito, very short papers, so difficult to push everything in there. I've really focused on the Canadian case, but I have actually situated the entire issue in the context of global trends in urbanization, and the fact that the United Nations has marked the year 2007. This is contested, of course, because it depends on how one defines the urban, a city, whatever. But 2007 is the year when officially, more or less, give or take, more than 50% of the world's population started living in cities. And this trend is only projected to grow. And Ito knows that I was particularly influenced by reading Kim Stanley Robinson's Ministry for the Future earlier this year, and she got to know him. She was actually on a retreat with Kim Stanley Robinson, and if you've read the book, you will know that it opens up with the most awful, it's set in the near future, of millions and millions of people die from an extreme weather event in India when the infrastructure of the city fails. And people go to a lake, but that doesn't help them because the water is literally so hot, it doesn't cool them down. So this is definitely, I think, an entire, moving forward, we have to really focus on these, on cities, and depending on where you are in the world, it's going to be the immediate, the short-term, long-term policy solutions will be different, and or what you would prioritize, because they're all going to be the same. It just depends on when you do them. I particularly appreciated the comment about the intergenerational nature, because in my paper, I've talked both about seniors and about children. And I think that we all know what's happened in the United States in the last 20 years, where literally generations have been set against each other, and you get grandparents voting against the interests of their own grandchildren. Politically, this polarization. So I think it's so important, and I will add in the terms intergenerational, and I meant to do it. And one last thing, and maybe I stop here, Ito, because I've forgotten what I was going to say, but I just really appreciate everybody's feedback. So many of our folk here in the room are coming in cold, and it's so good, Ito and Shawn, to hear so much convergence. To me, what I'm hearing is we all know time is running out, we have to move. There are many solutions. I think the one last thing I would say is nature-based solutions. They've been called many things in the past, planting trees, Wangari Maathai, you know. It's very clear from a huge, just came out in January 2024, in Science of the Total Environment, the bulk of nature-based solutions are happening in the global north, but not even in North America. So, you know, there's so much space for spreading out nature-based solutions. And of course, that is a huge priority of CBD, conventional biological diversity, and the UNFCCC. So this confluence, it has to happen, and we have to escalate it. And I'm really hoping Ito and Shawn, what we're doing here, will help to support and escalate and elevate. Somebody used the word elevate. That's a good word. Thank you. Thank you.
Thank you, Dawn. So I realize that we're a bit over the time, but before we leave, I just wanted to, before we leave and thank everybody, I just wanted to just add one tiny issue that I think some people raised, and maybe Marina or Maria, the financing, and so just going back to that, I think in addition to the intergenerational dimension, so that's a time dimension, I think financing dimension is going to be very, very critical, partly because if you look at what happened just recently with the Hurricane Helene and Milton, huge amount of, I mean, obviously it was devastating, you know, sort of hurricanes. But the result was that huge amount of money, public finance, get diverted to addressing that. And as we know, I mean, we're in public sectors and policies, that how do we make I think we need to sort of think about, you know, yes, addressing disasters and like immediate crisis is important, but how do we think, how should we think and address the issue of longer term public financing for care and climate change beyond sort of immediate disasters? Because the government and public reaction is, of course, you attend to those immediate, you know, disasters. But surely that, you know, I mean, that we should not be derailed and detracted sort of by that kind of, you know, a disaster issues. So that might be something that we need to, as a team, kind of think about when we look at the policy, you know, when we develop policy briefs. the financing and priority setting, well, short and longer, short to long term sort of policy agenda and financial allocation would be very, very important, I think. So with that, I just want to, well, thank you for participating, and thank you for coming and giving us lots of feedback. And please do feel free to continue to give us feedback. We are having, this is a beginning of kind of 1.5 day meeting for the Royal Society team, this project team, starting in about half an hour from now. So your feedback will be really, really helpful. So thank you. Thank you. 10 after the hour, so we should get started.